Hello, good nurses. Welcome to your Career Pathway channel, where we guide nurses on their pathway to success. Here is your career coach. This is NUS 111 Applied Chemistry, Module 4. In Module 3, we discussed bases, acid, and salt, including their characteristics and nursing implications. In case you haven't watched that video, kindly do yourself a whole lot of good by going back to watch that video. Here in Module 4, we want to understand electrolysis and electrolytes. What are the specific objectives for Module 4? 1. Define the following: electrolytes, non-electrolytes, and electrolysis. 2. Describe ionic theory and ionization. 3. Describe electrolytes and non-electrolytes. 4. Explain electrolysis. 5. Enumerate the composition of air. 6. Explain air pollution and purification. 7. Explain water pollution and purification. If you look at these objectives, many areas are marked with red. This indicates that this module 4, is very important for your next examination. Before we begin, let's look into the circles to success. Red circles, as we always know, tells us that these areas are must know for our examination. Orange circles indicate that these areas are good for clinicals. Green circles indicate that there is need for you to skim through this video at later times. We want to begin with Objective 1. Objective 1 says, define electrolytes, non-electrolytes, and electrolysis. This is very important. The nursing mantra says, no ions, no conduction, no heartbeats. If there are no ions, then there is no conduction. And if there is no conduction, there is no heartbeat. Electrolytes are not optional. They are your patient's pacemakers. You want to define basic key terms such as electrolyte, non-electrolyte, and electrolysis. Electrolytes, we'll look at the terms, the simple definition, and we'll look at a scenario that calls for attention by the nurse. What are electrolytes? Electrolytes are charged particles called ions in body fluid that conduct electricity. Example is sodium ion, potassium ion, and of course calcium ion. Here is a very important nursing scenario. Potassium, serum potassium, equal to 7.0 millimole per liter. This could lead to cardiac arrest. Why? Because excess potassium can stop heart depolarization. Let's look at non-electrolytes. Non-electrolytes are substances that don't break into ions. Examples are glucose and urea. Nursing scenario: IV error. Giving 50% dextrose, which is non-electrolyte, too fast can lead to osmotic diuresis, increasing seizures. IV error. Giving 50% dextrose, which is a non-electrolyte, very fast could lead to osmotic diuresis, leading to seizures. Nurses, take note. Electrolysis. Electrolysis is using electricity to split compounds into ions. Example in dialysis machines. Dialysis machines uses the principle of electrolysis. Nursing scenario: possibility of a dialysis crash. Wrong electrolyte settings in hemodialysis can lead to fatal arrhythmia in 10 minutes. Let's move to Objective 2. Describe ionic theory and ionization. Ionic theory explains that when electrolytes like sodium chloride dissolve in body fluids, they dissociate into positively and negatively charged ions such as sodium ion and chloride ion. One is positive, the other is negative. So basically in chemistry, when we talk about electricity, we are talking about electrolytes. So understand this, that positive and negative ions in the body are electric activities going on in our bodies. So this enables electrical conduction, which is essential for nerve impulses and muscle function, making precise intravenous electrolyte management critical, as undiluted potassium chloride can instantly hurt the heart by overwhelming cellular ion cells. What happens when salts dissolve? When salts dissolve in the body, this is ionization. So sodium chloride dissolve in water, leading to the splitting of sodium, which is positively charged at anode, and a chloride ion, which is negatively charged, a cathode. Salt breaks into charged ions. This is how they conduct electricity. Why nurses panic? Take note of these clinical scenarios. IV fluid must ionize to replace electrolytes. For instance, your normal saline 0.9% sodium chloride will dissociate in liquid, leading to the formation of sodium, which is positively charged, and chloride, which is negatively charged. So positive and chloride ions are formed, and this matches blood conductivity. There is a danger the nurse must take note of. 5% dextrose water is glucose and is non-electrolyte. It cannot conduct in the body, so there is no ions in it. If given alone, it will cause hemolysis, which is cell burst from osmosis. Now, this is what you should take note of. Your 5% dextrose in water has no electrolytes. In fact, in the hospital, when 5% dextrose in water is given, it is given to run alternatively. So we usually alternate it with other infusions. These are the nursing actions that you must take. Never give 5% dextrose water alone for more than 1 hour without electrolytes. You see what I was saying? So it's basic that they are being diluted with potassium chloride or sodium chloride, or given alternatively. Next, nursing action. Nurses must monitor for hemolysis signs such as chest pain, dark urine, which indicates hemoglobinuria, and there is also sudden spike in potassium ion in the lab. These are what you must take note of. You must fix them immediately. How do you do that? Stop the infusion once you see this sign. Stop 5% dextrose water, give normal saline to restore tonicity and treat hyperkalemia. This is very essential for the nurse in the practical session. Objective number 3. Describe electrolytes and non-electrolytes. Let's begin. Electrolytes versus non-electrolytes. The nursing sheet. Types. We'll look at the types of electrolytes, their examples, their nursing action, and life death alert. Strong electrolytes are used as IV fluids for electrolyte replacement. Life or death alert. Potassium chloride intravenous fluid is a slow infusion and it must be diluted. If it is undiluted, it will result to asystole and it will stop the heart. Number 2 is weak electrolytes. Weak electrolytes can also be called partially ionized electrolytes. Examples: acetic acid in vinegar and carbonic acid in the blood. How is it relevant to the nurse? Weak electrolytes are used in wound irrigation and arterial blood gas interpretation. Life or death alert for weak electrolytes. When bicarbonate is low, it will lead to metallic acidosis, leading to coma. What does bicarbonate do in the body? Bicarbonate helps to balance acid level in the body. When there is increased pH in the body, it will help to balance it. When the pH is reduced, it will also help to balance it. Right? How does it balance it? When there is reduced pH, which is acidity, it uses a CO3 minus component to balance the base. When there is high base, it uses hydrogen ion to balance the acid. Non-electrolytes. Non-electrolytes can also be called zero ionization electrolytes. Examples are glucose, urea, and ethanol. Nursing actions. Non-electrolytes, which are zero ionization electrolytes, are used as dextrose infusion and in drug metabolism. Life or death alert, ethanol should never be given IV. Nor is a non-electrolyte and could lead to seizures and hypoglycemia. Objective number 4, we want to explain electrolysis. I have said before that as a nurse, when you hear electrolysis in chemistry, we are not talking about electricity in physics, but the knowledge of electricity will give us understanding. So what does that mean? It means that there are electrolytes, which are positive and negative elements working in the body, conducting their own electricity that is different from the normal electricity we know about. When you understand electrolysis, you don't just run dialysis, you prevent cardiac arrest. Electrolysis. Electrolysis is a chemical process that uses electricity to drive a non-spontaneous chemical reaction. It involves the passing of an electric current through a substance, usually in a molten or aqueous state, to cause a chemical change that wouldn't typically occur on its own. Key components of electrolysis are as follows. 1. Electrolyte. Electrolyte is a substance that undergoes electrolysis, which is usually an ionic compound in liquid or aqueous form. Electrodes. Electrodes are two conductors, typically made of metals or graphite, that are placed into the electrolytes. These are anode and cathode. So electrodes can either be anode or cathode. An anode is a positive electrode where oxidation, which also means loss of electron, occurs. So oxidation is loss of electron, which happens at the anode, and reduction is gain of electrons, which happens at the cathode. A cathode is the negative electrode where reduction, which is a gain of electron, takes place. Electrolysis. How does it save or kill our patients? What happens in a dialysis machine? So this is an example of what happens in a dialysis machine. The dialysis machine uses electrolysis in action. So what happens is that during dialysis, the blood, like I said before, there are electric currents in the body, not just in the machine. Positive and negative electrolytes going on in the body. Negative and positive reactions going on in the blood. So during dialysis in the blood, there is reduction of urea and there is reduction of potassium ion. This will decrease toxins. So the dialysis machine uses electricity to pull ions through a particular membrane. These are nursing critical points. Dialysate fluid must match blood electrolytes. A dialysate fluid is the fluid that is used to remove these toxins from the blood. When preparing them, they must match the blood electrolyte. For instance, sodium ion must be between 135 to 145 millimoles per liters. Wrong setting may be low sodium dialysate. This could lead to hyponatremia and could lead to cerebral edema, which may eventually lead to death. There is need for real-time monitoring. The nurse must check serum electrolytes every 30 minutes during dialysis. So the nurse is checking to ensure that these electrolytes are in their correct proportions. Objective number 5, to enumerate the composition of air. When you know air compositions, you don't just give oxygen, you avoid oxygen toxicity. This is chemistry in your hands, not a textbook. So let's look at the composition of air. Air is made up of gases. The gases in air, we will look at the percentage and then the nursing impact. Number 1, nitrogen gas. Nitrogen gas makes up the bulk of air gases and it makes up 78% in air. How does it apply to nurses? Nitrogen gas acts as an inert filler. It doesn't have any clinical role to play, but it can displace oxygen, leading to pneumothorax. Pneumothorax is a collapsing of the lungs. What keeps our lungs is the oxygen. When inert fillers, which are argon, helium, find their way into the body, they do not play any clinical role, but they may displace oxygen, leading to the collapsing of the lungs, which is called pneumothorax. Another composition of air is oxygen. Oxygen gas makes 21% of air. It is important in life support. Titrate oxygen to keep SpO2 at least greater than 94%. To titrate means to keep in the right proportion. So, in the hospital, SpO2, which is saturated oxygen pressure, must be at least above 94%. SpO2 level is in percentage, which means it can never be above 100%. So what happens is that with regards to oxygen gas, nurses titrate oxygen to keep SpO2 at least greater than 94%. And SpO2 less than 94% indicates poor saturation of oxygen. So SpO2 is the amount of oxygen present in our hemoglobin, and it should be above 94%. We also have fraction of inspired oxygen. Fraction of inspired oxygen greater than 60% can lead to oxygen toxicity and leading to acute respiratory distress syndrome. Why SpO2 has to do with how well oxygen is dissolved into the tissues. Fraction of inspired oxygen tells us how much oxygen you are giving to a patient. Above 60% must be given for only 24 to 48 hours. If it exceeds 28 to 48 hours, it could lead to oxygen toxicity, leading to acute respiratory distress syndrome. Another gas in the air is carbon dioxide. The percent of carbon dioxide in the air is 0.04%. This is a very relevant nursing alarm trigger. If there is a rising CO2 in the body or in the blood, it could lead to respiratory acidosis. For example, opioid overdose can cause an increase in CO2 and others. Argon and other inert gases are 0.96%. They are usually irrelevant unless patient has gas gangrene with regards to anaerobic bacteria. So usually there are some bacteria that causes infection in the body that do not need oxygen. So this is just a practical statement which tells us that there are bacteria in the body that do not require oxygen. So basically, an increase in oxygen could kill. are negative pressure rooms? Negative pressure rooms are special rooms in the hospital that are designed to prevent airborne infections. HEPA filters are hospital-grade air purifiers that help to trap 99.97% of particles greater than or equivalent to 0.3 micrometers, including particulate matter, bacteria, and viruses, preventing ventilator-associated pneumonia in ICU, in intensive care unit patients, and containing airborne pathogens like tuberculosis in isolation rooms. This makes them non-negotiable for protecting immunocompromised patients or critically ill patients. Objective 7, we want to explain water pollution and water purification. We want to look at water pollution and purification, infection control, pollutants that cause hospital outbreak. So we'll look at contaminants, risk to patient, and nursing fees. Heavy metals are pollutants that can be found in water, such as lead and mercury. They cause risks to patients, risks such as neurotoxicity that could lead to dementia. So you see that there are other things that could cause dementia. Nursing fix. How do we fix heavy metals in hospital water? There is need for us to use distilled water for nasogastric tube and nebulizer. So there is need for us to use distilled water for NG tube feedings and nebulizers. Another contaminants are bacteria, which are also known as Ella. Bacteria in the water can lead to Legionnaires' disease, such as pneumonia. There is need for the nurse to flush taps 2 minutes before use. This can help to kill biofilms. So before you use the tap water or drink the tap water, ensure to flush the taps at least 2 minutes before use. Another pollutant is chlorine and its byproducts. Chlorine and its byproducts can damage the kidney in dialysis. So there is need for the nurse to ensure reverse osmosis water for dialysis preparation. We have said before that dialysis is the water that helps to remove toxin, and it has to be purified. The way to purify the water in the dialysis unit is to actually put the water through a reverse osmosis. You know that in osmosis, water moves from a lower concentration to a higher concentration. In the dialysis ward, the water is made to go the opposite direction. In fact, in the dialysis ward, the water is filtered using an activated carbon filter. This could remove any form of impurities in the water that is being used as a dialysis. But let's look at water purification in nursing practice. Boiling is a type of water purification. It kills bacteria, and it is used in the hospital for wound irrigation in some resource-limited areas, such as the rural areas. Second purification in nursing is chlorination. Chlorination is used in municipal water, but it ruins dialysis. Dialysis water requires carbon filters. You get that? For community use, there is need to chlorinate the water in order to remove bacteria. However, chlorinated waters are not used for dialysis. So there is need to filter this water using carbon filters before used as dialysis for a patient. Next water purification method is distillation. Distillation helps to give pure H2O for med reconstitution. Example, in IV antibiotics. There is critical alert that every nurse must take note of. Never use tap water for central line. This could lead to endocarditis. So whenever you use the tap water for central line, you risk endocarditis. As I round off, there is need to take note of some specific areas which I've mentioned in this video. Take note of Objective 1, Objective 3, Objective 4, Objective 6, and Objective 7. Many examination questions come from this area. These are possible exam questions for your next examination. Number 1. Define the following terms: electrolyte, non-electrolyte, and electrolysis. Number 2, explain ionic theory and how it helps in understanding the behavior of electrolytes in human body. Number 3, differentiate between electrolytes and non-electrolytes, giving 3 examples of each and their nursing relevance. Number 4, describe the process of electrolysis and mention 2 practical applications of electrolysis in healthcare or laboratory practice. Number 5, discuss briefly the composition of air, the causes and effect of air and water pollution. List 2 methods each for purifying air and water for hospital use. Quick tips. Take note of this. A dialysis patient has muscle cramp. An ECG machine shows peaked T waves and serum potassium is equal to 6.2 millimoles per liter. What is wrong? Here is the answer to the question. Peak T wave indicates hyperkalemia. Hyperkalemia is indicated when potassium ion is greater than 5.0 millimole per liter. What is the cause? Dialysate potassium setting was too high. This led to potassium ion not being removed from the blood. Nursing action. Immediately stop the dialysis and give calcium gluconate IV. This will stabilize the heart. Insulin and glucose helping to push potassium ion into the cells. Number 2, take note of this. Electrolysis is not equal to body chemistry. Why electrolysis is not equal to body chemistry? Electricity never flows through your patient's blood. Electrolysis only happens in machines. Dialysis and arterial blood gases analyzers. Your job is to trust the machine settings. They are based on ionization. So when we talk about electrolysis, understand it that you have to work on the dialysis machine to ensure that they give the accurate level of electrolytes. I want to thank you for staying thus far in this video. If you have not subscribed to our YouTube channel, kindly subscribe if you like our videos. Comment in the comment section and let us know how you feel about these videos. Till we meet in Module 5, it is goodbye from me.